So good morning, my name is Gianfranco Villaciano, a student nurse from BSN 1D, and I will be your student nurse for today. Today, I will be showing the abdominal assessment. So, before we start our assessment, we must ask our patient to empty their bladders for us to have a more accurate result. Ask the patient to remove their clothes and put on a clean gown. Next, assist the patient on a supine position. Fold their arms across their chest like this, or you can simply put them at the underside. To promote comfort of the patient, put a pillow underneath his or her head and flex their knees and put a pillow underneath to promote comfort. Fold the patient's gown or clothes to expose their abdominal area and near the pubic area. Next, we will inspect the skin, noting color, vascularity, striae, scars, and lesions. Inspect symmetry and contour of the abdomen. Next, we will inspect the umbilicus, noting for color, location, and contour. Inspect abdominal movement, noting respiratory movement, aortic pulsations, and persistic wave. Next, we will be auscultating for bowel sounds, noting for intensity, pitch, and frequency. Using the diaphragm of the stethoscope, we will start in the right lower quadrant and move it clockwise as we cover all the quadrants. It will be done up to 5 minutes and minimum of 1 minute. Any high pitch or abnormalities will signify obstruction. Next, we will be auscultating for vascular sounds and frictional rubs using the bell and the diaphragm of the stethoscope. And next, we will now be percussing the liver, noting for tympany and dullness. Perform the scratch test using one finger and the stethoscope. Next, percuss the spleen. Next, performing blunt percussion. Using your left hand and the ulna of your right wrist, put it against the back of the patient and strike it using your right wrist, like this. Note for any tympany as you percuss. Next, performing light palpation and deep palpation, noting for tenderness or masses. Use your fingers starting on the non-tender side of the abdomen. Palpate for the umbilicus. The surrounding must be free from bulges, masses, or any nodules. Next, Palpate for the aorta. You can use your first two fingers or your two hands in palpating the aorta. Next, palpate for the liver, noting for consistency and tenderness. Using your left and right hands, put your left hand under the patient's back on the right side of the patient. While the left hand is under the patient, put the right hand on top of the patient's abdomen on its surface parallel to the left hand, and perform the upward and then inward while telling the patient to inhale, and after performing the upward and inward, ask the patient to exhale slowly. Palpate for the spleen using an inward and upward motion of the left and right hands on the surface of the abdomen. Next, we will be palpating for the kidneys. Next, we will be palpating for the urinary bladder. If you inspect for ascites, perform and palpate for shifting dullness. This needs special palpation techniques. Perform fluid test. As you perform fluid test, there must be no fluid waves present. Testing for appendicitis. The McBurney test. If the patient feels stabbing or any pain, this elicits appendicitis. Robsing sign. Elicit pain on the left lower quadrant of the patient. It must be deep and it must elicit pain to the patient. If there is any pain showed by the patient on the right lower quadrant, this suggests appendicitis. So a sign. Ask the patient to do a side lying position on his left side and hyperextend his right legs, and if there is any present pain on the patient, any stabbing, this suggests appendicitis. Obturator sign. Ask the patient to flex his knee to the left and to the right side, and if there is any abdominal pain on the right lower quadrant, it suggests appendicitis. Hypersensitivity test. In this test, you can simply use your first two fingers. On the right lower quadrant, pinch the patient's abdomen several times, and if the patient shows pain and overreaction, this suggests appendicitis. Perform the test for cholecystis or the Murphy sign. Put the tips of your fingers on the right costal margin, and if there is any pain elicited, and after, formulate appropriate nursing diagnosis and make necessary referrals to the patient. And after, perform the aftercare of the materials. That is all po, and thank you.